The Ayana S. Dyette Foundation for Cervical Cancer is an NGO that continues to be committed to the efforts in educating, preventing and eradicating cervical cancer. And they're excited to announce they're hosting their 4th Annual PAP Party 2024. Joining us this morning for a conversation is Ms. Paige Ribeiro-Agard, Director and Marketing Lead. Good morning, Paige. How are you?
Hi, good morning. I am great. How are you doing this morning?
I am well, thank you for asking. And I'm looking forward to this conversation because it's something that really is transformational and of course has some great depth behind it as well. So before we get into the PAP party, Paige, can you tell us about Ayana?
Ayana Sasha Dyette was her name. My aunt, she was only 32 years old when she succumbed to cervical cancer. National volleyball player, fit like a fiddle, the life of the party. So the very last thing you expected was, for her to pass from cervical cancer. Ayana was one of those persons that always advocated for life. She was an insurance agent herself. So health was something that she was in fact focused on. However, Ayana did not do what she was supposed to do to prevent this from happening.
Thank you for sharing that with us this morning, Paige. And of course, viewers, you're seeing some beautiful images there of Ayana. And of course, the foundation now is having their PAP party on the 27th of July. Paige, what does the PAP party comprise of?
Right. So the PAP party, as women, when do we get time to go take care of ourselves while enjoying doing so? Sometimes when we have to go do any of our routine checks, it's always a deterrent because it's not fun, it's a long wait, all the other excuses that we can come up with. But PAP party is for the woman. It's for us to focus on cervical cancer while we also get to highlight other health issues that us as women, we face on a day-to-day basis. And it's really giving us the opportunity to give back to the public in a way that we can eliminate all the boundaries and the challenges that people have when it comes to getting their PAP test. But not just their PAP test, testing yourself for diabetes, HIV, HPV screening, HPV vaccinations, all these things are very essential. And at PAP Party, we really want to be able to highlight that and to also offer these services. Thankfully, we have members like Border Life who would actually, do the screening of the PAP test. So we're really looking forward to being able to just invite all the women to come out and take care of yourself because your health is your wealth, ladies. You have to put yourself first.
You definitely do have to put yourself first. And I mean, hats off to the entire team at the foundation for really combining the joy element into doing something that admittedly can definitely be a little bit intimidating for women, regardless of age. Now, let's go into the necessity of having pap smears and HPV. We know, the general conversation around it, but why would you say it's essential?
Right. So, HPV is one of the most commonly transmitted STIs that we have globally. And fun fact, or not so fun, about 80% of us will contract HPV at some point in our lives. Now, the reality is our bodies are able to fight it off, but in many cases, we are not. We have two particular types of HPV, and they're known as the high-risk types, that's HPV 16 and 14, and they are very prevalent when it comes to cervical cancer. They actually cause more than 70% of cervical cancer cases. So when we look at those statistics and those numbers, we are speaking about a disease that, one, is highly preventable, but two, it is extremely prevalent. So the idea is the vaccination is now going to prevent that contraction. We have had many cases on a global scale that has proven that the HPV vaccination has reduced cervical cancer cases significantly, with Australia being probably one of the first countries to possibly eliminate cervical cancer on a global scale. For us women, it's really important for us to not just do the PAP test, which we have definitely been advocating for, but the idea is you want to also protect the youth. The youth is our future generation, and the vaccine is okay for them. So therefore, our advice, or rather for me, as you asked, why are we encouraging that? We're encouraging that because we want to save lives. We want to prevent our youth from contracting the high risk types of HPV that can possibly lead to cervical cancer, but not just cervical cancer, because HPV causes many other types of cancers. We have anal, penile, vulva, vaginal. And I mentioned anal and penile and throat cancer because those cancers also affect our men. So we're not just talking about the HPV vaccine for women only or for girls only. We are encouraging our young men or our young boys to also be vaccinated. Right? World Health Organization would advise those vaccines to be administered from age 11. We even have as low as age 9, right? But from age 11 to age 26 years old is the ideal time for us to be vaccinated. However, according to CDC and World Health Organization, the vaccine can still be administered up to age 45, 46.
Paige, thank you so much for sharing that data with us this morning. Now, you've mentioned, of course, the youth, critical. What is the relationship when it comes to secondary schools and the foundation? I know that you have some initiatives being worked on.
Yes. So for ASDF, we are really trying to invest in our youth as well and educating them so that we can prevent any further cases of cervical cancer and the other cancers mentioned. The youth right now, what we have is we have two things working on. We have the HPV drive, which would essentially be in collaboration with Ministry of Health. And that would be to encourage the secondary school children to still get the HPV vaccine and to have that HPV drive, really implemented into the secondary school systems. We do understand that sometimes it's a matter of us actually reaching out to the parents. So we've aligned ourselves closely with some of the Parents Teachers Association of some of the schools, and we encourage the PTAs of the other schools to reach out to us as well, because we are very, very eager to come and speak to the parents about the importance of the vaccine and what they can do to protect themselves and their kids moving forward. We've had a really good response from the secondary school children so far. They are very much in tune with themselves, and they're very excited to know that they can take care of their health and invest in themselves at such a young age.
Excellent. Paige, what can attendees expect when they arrive at the PAP party on the 27th of July?
Well, ladies, just think excitement, excitement, excitement. I mean, we have entertainment from the moment you enter the door, but it's really, I want you to come and immerse yourself in a day of health. A day of health and wealth, because at the end of the day, your health is your wealth. And at PAP Party, you're going to be able to experience that. You're going to have health professionals there to answer questions for you. We have numerous number of exhibitors there, people from, a variety of different types of organizations. So we have some insurance companies would be present, PALIG. We do have Miss Braffett. Ministry of Health would also be there. We have a number of doctors and nurses present. Entertainment galore, as I mentioned before, games, some giveaways. I don't want to spoil it all, but definitely Saturday, the 27th of July, it's all about PAP Party, ladies.
Understood. And this is going to be a phenomenal event. Hats off to you and the entire team for ensuring that the information is being shared and the services are being offered. Paige, thank you for joining us. All the best, and continue to do what you do. It's our pleasure.
Thank you so much. Pleasure. Okay, bye-bye.
Bye. Paige Ribeiro-Agard joining us this morning to talk about the 27th of July PAP party, definitely with a twist. So something that I've noticed this morning is that we have a lot of health parties coming up.
Well, I mean, I think it's one of the things that the Minister of Health has been advocating for us to just be more aware of, more mindful of what we put into our body, how much we exercise, how often we check up on ourselves. And I think it's refreshing to see so many people taking that initiative and saying, all right, I want to put together this thing for my community or my section of the country to be able to check on themselves and make sure that things working out or they're not working out and you can rectify them as soon as possible. Before we take the break, I just wanted to take a moment to hail out Miss Marshall. Miss Marshall would have given us all, the three of us, Ayinka, myself and Natasha, some towels with our names engraved in the towels earlier on this year. We just want to say thank you very, very much, Miss Marshall. We appreciate them so very, very much. Let's take that break and come back with more. When we come back, it's Christmas in July. Stay tuned.